we were given the task to build a primary healthcare center for 50 sites within Sierra Leone. Within Sierra Leone, there's 4 distinct geographical regions that we have to consider. This includes the coastal Guinean mangroves, wooded hill countries, upland plateaus, and eastern mountains. And so to build a footprint that could accommodate with all of these, we started out by making a 25-foot by 27-foot by 3-inch thick concrete slab. This is just so if we have any large amount of water or large amount of rain, which is very common within Sierra Leone because of the rainy season, the building will be able to stand with that. With that footprint, it will require about 6.25 cubic yards of concrete. And to get that in, we would use an outside contractor, such as Utrenes, which is someone that we looked up that's within Sierra Leone, and they can bring in a reversible drum mixer so that we can do a large quantity on site and not have any problems with it. For the walls, we decided that if construction will be during the dry season, which is between December to May, we will use the mud bricks so we can build them on site. If the construction has to be during the raining season, which is from May to back to May to November, we will have to use the concrete blocks just due to the fact that it would be more difficult to build the mud bricks during that time. For our door frames and window frames, we'll be using wood and the rafters as well from local sawmills and lumber mills because there's a large quantity within the Sierra Leone region. After that, we will be using within the observation room and the sterilization and treatment room, we'll be using ceramic tile also because this will make it a lot easier. Instead of the more coarse material such as concrete, the tile will be a lot easier to clean and sterilize quicker.
Alright, and in these rooms, we have the sterilization and treatment room, and we thought of putting, that's this room, we knew it was important to have a sink, so once you treated the patients, you could wash off your hands and make sure they're sterile and wash them off. We have a refrigerator for any necessary medical supplies, and multiple seats for different faculty or the patients if there's more than one that can be treated at the same time. And then there's a storage cabinet for any other needs. In the observation room, we have 2 beds for extended stays if they, or not extended, but if people need to be treated for more than just a short period of time, and stools and a cabinet for the doctors. The storage room, we have cabinets and shelves for storage. That was kind of tough to fit in because of the small space. And in the consultation room, we have a desk and stool for the doctor and a bench for the patient to be there. And also, we thought it was important to have multiple seating here, so if need be, the whole family could come in and know what's going on, and the doctor could explain them thoroughly what was happening. In every room, we knew it was important to have the trash disposals for hazardous waste, so that can all be confined, taken to an off-site location and incinerated.
We also have a storeroom that will be located here. This is where we would store like all the excess medical instruments and medical medications that we would have that doesn't require any cooling, and also extra Ebola suits in case there's a major outbreak in the site. Also, we will supply interior locks to the inside storeroom because in some areas, some of the local civilians will think this is just a propaganda and might cause a riot or something. So to try to keep some safety, we'll put the locks on the doors and on the windows because the windows will be open shutters. Because while doing research, we've seen that the majority of the housing there, open shutters is regular.
Along with that, we have a therapy room, which is like the waiting room. We spoke to occupational therapy students, and for a basic room, they said to make sure you have mirrors, chairs with firm backs. We have stools in all the rooms except the waiting room, therapy room, where we have hard backs. And we also had mats on the floor for anything, any physical therapy or occupational therapy activities. They also said small things like putty and different things for hand, but that was not in the furniture that we included on here.
Next, as I mentioned earlier, we'll have the medical supplies in the storeroom. We also have a refrigerator up here in the sterilization room for some of the colder medications. For the equipment, it includes, we just want to do the absolute essentials such as like you want to have some defibrillators, catheters, blood pressure monitors, and other essentials. And also for medications, we looked at the World Health Organization, and what they defined as essential medications in the Western African region. And so we'll have a majority of those located within our site as well.
On top of our structure, we talked about having a double roof, having an aluminum roof, and then on top of that, a thatched roof with about a foot gap in between to increase the ventilation. The roofing, we looked up local companies, and that could be supplied easily in most areas throughout Sierra Leone. With the roof, the ventilation was a big thing because it is very hot in Africa, and so ventilation was key. Along with all the rooms, the windows and the doors are set up so that there can be cross breezes to incorporate great ventilation throughout the entire site.
And then we knew we needed a 3 kilowatt solar panel. As was brought up earlier, we now know we don't have enough solar panels, but we just kind of put it on to represent where they would be. They would be south facing, so it would give maximum exposure to the sun. And we also have, in here is our water tank. It would be black body, and it would have windows facing the south side to create almost a greenhouse effect with low mass walls, so it would be cheap for construction and capture the heat and warm the water even further. And with the windmill, I'll take over.
We also have this windmill as here because while doing research, there's a lot of winds during the from November to May. There's a lot of winds coming off the Sahara Desert called the Harmattan winds, and this will be facing this will be having east orientation just so we can supply some extra power. If the solar panels are not feasible in some areas, we could also possibly apply a windmill as well.
Some of the areas there talked about not heavily forested, but there are some areas where there's more trees and solar panels might not be able to be feasible. Therefore, the windmill we thought being taller would be able to capture this wind. We also had our triage tent outside. We made sure we had hazardous waste disposal equipment, and we also were going to put the ceramic tile in there for easy cleanup, and we just put benches for people to wait. And then this is located just slightly to the north of our building.
Question? Yeah, about you call it a windmill. Are you visualizing a wind turbine?
Wind turbine.
Okay.
Sorry.
Yes.
Sorry
Yes.
about that.
And is this something that is locally available to produce, or is it something that
I looked up. There was like one very small company that did it, but they were pretty expensive. I mean, we put it in there just for a possibility, but if the budget doesn't allow for it, which the budget would be pretty large for that wind turbine, but it would be nice to have.
Comparing your sterilization type rooms to some of the other groups, yours does not seem to have a sink, does it?
There's a sink right here.
Okay.
Yeah,
Now, you're gonna see patients, so why do you call that in that room? So I'm thinking something different sterilization room than you are maybe. So my question is, in any of the videos and things you looked at, are you actually using the clinic for diagnostic testing at all? Like when people come in, are they having malaria tests, or are they doing that in, so like pipettes, were they cleaning, so they use everything?
That would be in the sterilization room,
Okay.
where they try to find out what, if they don't have Ebola, what
Right.
is wrong with that.
You probably wouldn't want to see patients in that room where the lab tech's running the tests, do you think? So would you want like a separate room for sterilization, laboratory tests, equipment, versus having, it could be a multifunctional room,
Okay.
which would be fine, but,
In the consultation room, they could also take patients to do more of the testing than on the sterilization room to actually find out what's
it
wrong
could be a
with
smaller
Ebola.
area. I know I had a student in Ghana for a semester, and first she was aghast at like cleaning out pipettes to reuse them again, but this is what you have to do. So in that area, you know, as far as decontamination, wastewater contamination, cleaning, stuff that we throw away all the time.
The question on the, is there something in the guidance that you had that led people to think you needed a therapy room?
No,
Yes.
they asked
for it.
They
specifically.
specifically.
It was a waiting room on the original footprint, our floor plan when it was an amputee village, and then they specifically said they're gonna put the waiting room outside, and they wanted that room to be specifically occupational therapy, physical therapy, so, yeah, that was from the client.
Just a question for you, would it be possible to do like the people going through the, what we call sterilization and treatment room during the day, and then at night, could the physicians all then do the test at that time then after cleaning up and?
I would say some of them are really quick, they do have some tests that you wanna do while the patient was there, malaria versus a typhoid or something else, or quick type, blood type test that they still do. So I think some would have to be done in the room, in another room, so you know what the appropriate treatment would be. So like I said, it could be a dual purpose room if the clinic wasn't busy, but if you were really busy, you probably wouldn't want to be running that in the same room.
And some of that was limited just by the floor plan we were given. We tried to make the most of our space.
Right.
Did I hear you say there was a ceramic tile, was that available?
Yes. In low quantities, so that's why we only did it in the 2 rooms.
But that's in blocks, so it's not sealed between the blocks?
The grout is porous, guys. The ceramic is very durable, but it is not great for a medical setting. So, from a durability perspective and the tile itself, sure, but it's the grout that's the issue. It absorbs everything.
The choices were dirt, concrete, tiles.
Well, hey, if you pick good, better, best, you pick the best.
Yeah.
And you really did your research, guys. You did a really good job with that, finding out what Sierra Leone is all about.